edition YouTube Live with Dr. Nguyen Phan. He is an amazing internist, doctor of internal medicine. If you don't know him, he has turned his practice into exploring more holistic support for his patients, along with doing full-fledged medical work. As you can see in his background, he's got amazing Vimergy supplements. He offers those to his patients. Uh, he's a beautiful human being. I love that. I feel so super blessed and lucky that I get to call you a friend in this lifetime, Wen. And so welcome to the Q&A. Thanks for being here.
Same here, and thank you for having me. And I'm quite blessed to have you and all the community in our lives. Huh?
Yeah, it's super cool that we get to do that. We've got a nice Q&A lined up here for you today. We're going to be talking about hormones and Dr. Phan's specialty. I think says he's worked a lot with thyroid patients and thyroid issues. And so, Dr. Phan, where would you want to start the conversation today? Just let's talk about, let's first talk about your patient, like demographic. Do you see mostly women, mostly men, in between? How does that break up for you?
Well, yeah, I see both, and the majority of patients who want to talk about hormones and maybe alternative medicine will be women, because the majority of women are those who have, let's say, Hashimoto's, which is the most common cause of hypothyroidism, are women, and this is consistent with what Anthony tells us. And before I would just jump totally on board medical medium, these were the things that I found out kind of the hard way, and this was, basically corroborated by his information. And it was like, oh, that makes sense why this occurs.
So give me an example of something you were able to corroborate.
So what I found was the majority of people coming to see me seeking answers had seen multiple other doctors. Primarily, they've seen an endocrinologist or their primary care doctor, and they had been to multiple doctors prior to that, and they were looking for something else. And that initially took the form of desiccated pork thyroid, basically. And because they wanted T3, which is a type of thyroid hormone which is more powerful than the T4, which is the less potent thyroid hormone, people were looking for that. And it was a trend back then, and still is, I could say, to seek doctors who would prescribe these medications, because they would ultimately make the patients feel better, and they didn't really know why. And there was all sorts of theories. But this is what we found. Women tended to come to see me more, and they tended to want the T3 formulation of that hormone.
And so do you also find, like, you've worked with a lot of women with thyroid issues, but do you find that as they get older, do they also want support with, hormone replacement therapy and that kind of thing that has also fallen into your purview?
Right. So I tell people all the time, you'll hear this over and over again. I used to be like the Oprah Winfrey of thyroid hormone and bioidentical hormone replacement, right?
Yeah.
So it was, here you go, you get thyroid, you get hormone, you get thyroid. And what you realize was that when you give hormones, the sex hormones like the estrogen, progesterone, testosterone, you're creating competition for thyroid binding hormone. So you would
Yeah.
actually give thyroid hormone to kind of compensate for what competition there was. And this was a common practice amongst those, wellness doctors and wellness doctors who are primarily focused on women's health. And I'll tell them, many of these doctors were either family practice doctors who found like this is much more lucrative, this is much easier to do than primary care, or OB/GYN doctors who were kind of older and didn't want to catch babies at 3 a.m. anymore. So we're focused on women's health, which primarily said, hey, I'll just pump you full of hormones every 4 months. You pay me a certain fee. I'll put some pellets in you or whatever it is. I'm happy, you're happy, and you can have relations with your husband again like you were before. And of course, those promises sometimes fall short because you're not addressing the whole picture. And what I'll say is, when you're having issues with thyroid, or whatever symptoms you think is thyroid, it is hormones, but it's adrenaline, cortisol that you really need to work on.
Yeah, that's a really key piece, that it's the adrenaline, cortisol. that is so key that, of course, Medical Medium writes about that in every single book. He's got a
Yeah.
chapter on adrenaline, right? And then he's got adrenal snacks. So I don't think there's like one book on adrenaline, but I think if you put together all of the pieces that go into, um, you know, uh, all health areas, adrenaline plays a role in every single one of them.
Huge.
So,
And
yeah,
you said before, protect your adrenals like it's gold at Fort Knox,
yeah.
or you will get knocked out. So,
Yeah. And for those of you who are just joining us, put your questions for us into the chat box. We're here to talk about them, address them, go into more depth with them. Dr. Phan, what would you say are the concerns? Because so many women here who are battling chronic illness and chronic symptoms are also looking and wondering as they heal, they're looking to think about, I want to have a baby, I want to have a family, I want to get pregnant. What is the role? What should a woman do to support herself with her hormones as she approaches this time in her life? Like if she's got a thyroid issue or she's got any other hormonal issue, what should she be doing to deal with a hormonal issue? And also extending that into when women are pregnant and if they end up with hormonal issues, then what would you recommend and how do you deal with that in your practice?
well, I can tell what I do, and I can't give you specific information. You'd have to rely on your healthcare professional for that. And remember, my talking here is mostly educational because of medical legal stuff. So in my practice, what I recommend for patients are um, look at the symptoms, and many of the symptoms he'll talk about in the books as far as these are actually the symptoms of thyroid. Because think about it, how many of you here know the difference in adrenal symptoms and low thyroid or hyperthyroid symptoms? What is the difference between those symptoms? Have you ever thought about it? Because many of them, if you read the other books, they overlap. Like I'm tired. Okay, yeah, right. I'm losing hair. I'm fatigued. I have brain fog. These are not specific symptoms. They're very kind of like vague symptoms. But some of these different ones will tell you, oh, this is mostly adrenal and stuff like this, versus this is some thyroid, right? Um, Many women have had normal thyroid tests by their primary doctor, right? If you have normal thyroid function, don't throw yourself on thyroid medicine, please, because you're going to create a dependence. Think about what the thyroid does. The thyroid sees that hormone coming in and goes, you're handling it, I'm going to take a nap. And so you become dependent on thyroid hormone. You may get a little boost from T3 or other thyroid hormone, and there's a psychological boost too because you're on something finally. So that's basically what you have to be careful about that. Um, uh, Work on your adrenals. Bring on some of these adrenal formulas, adrenal snacking. Those are the cheapest thing is adrenal snacking. Eating a piece of fruit or adrenal snack, Anthony has recommended, every 90 minutes to 2 hours. Those are the simple things you can do. You're on a budget. That's the first thing you can do.
Yeah, I mean, it doesn't get cheaper than doing adrenal snacks, right? It's not an expensive supplement. It's just making sure that you have enough of a certain type of balance of food in your body. If you do not have a list of these snacks or you don't know what we're talking about, I'm going to drop into the chat box a link to the energy boosting snacks that we're talking about. So just go ahead and click on that. You can click on that and, um, you know, be able to just download it. And so you have that. And I recommend that you get this download, print it, put it on your fridge, and keep it as just eyeballing it. I think people who also are on, the healing path for a long time, sometimes the snacks fall away and we just forget about them. Sometimes when we're super focused on adrenal support, we will tune into them and do them regularly. And then for some people, they just fall off and fall away. So I think that's important. We've got a really good question here. So two questions about menopause. Christina Lee says, I'm going into menopause. What should I be concerned about or looking out for?
So menopause is, in conventional world, defined as 1 year of not having a menstrual cycle, basically, right? And so the things that typically you'll see with menopause are you'll have some hot flashes, you have vaginal dryness, some people get irritable and things like this. And these can all be kind of put under the adrenal issue, actually. If, back in the old days, Anthony says, is that before the Industrial Revolution, when all these pathogens were not there, all the pollutants were there, women would go through menopause and they're like, man, this is great. I don't have to worry about having a cycle. Now I can have relations with my husband without getting pregnant. Things were a lot easier. But after the Industrial Revolution and whatnot, women started having symptoms. Men too, but we don't hear about men saying, "Oh, I got menopause." They get hot and sweaty and stuff like this. So this is a sign that your liver is working overtime, is inundated. Most of us are. We have stress hormones and pollutants in our liver. I've got 27 happy meals in my liver, probably still waiting to come out.
Oh,
And
that's
so you work on the
about
liver.
more than that when I was a kid.
More than that, right?
Yeah.
So you work on the liver. You look at this thing. You might be as easy like, hey, I'll take some Vitex berry or Shashandra berry, and my hot flashes are better. But looking at the angle of the adrenals, because I think we paint this picture of menopause as one of the worst things in the world, and you get hot flashes and crazy. And if you understand it better from an adrenal standpoint, I think you're going to be much more equipped in how to handle it, things you can do for yourself, rather than saying, I need hormones, I need to go there. But think about hormones, right? You go see a doctor, you need to get a hormone prescription. Those hormones, even if you don't have a uterus, those hormones are working on your breast tissue that are still receptive to estrogen. And if something happens, you've got a little lump there and it gets bigger and bigger, you have to be careful about that, right? So you have to be very careful. The hormones, are they feeding other things like viruses and pathogens and stuff like this?
Right. Yeah, no, agreed. That's so important. So women are asking, so what should you be concerned about? Definitely what Dr. Phan just said, watching for your adrenals. And I also want to point out that there's we call menopause symptoms hormonal symptoms, but if you break down each symptom of menopause, like hot flashes or loss of hair or mood swings or weight gain and things like that, all of them do not point to root cause menopause. The root cause is adrenals, liver, all of the things that Dr. Phan was talking about. So someone asking this question, which is like, how do you balance your hormones after menopause? What does that even mean? Like, are we looking to what are we trying to balance? Or rather, what is the effect that we're looking to achieve that we think will be achieved by balancing hormones? Are we looking to, so Tina Beebs, it's a good question. So tell me a little bit more about your question. Do you want to, are you wanting to feel better with menopause symptoms? If so, I would, recommend that you start adrenal healing stacks and start maybe a little bit of licorice or ashwagandha, things like that. I might also suggest that you, do a little bit more reading with the medical medium books. Like the first medical medium book has a beautiful chapter on adrenal fatigue and adrenals. And he also talks about how there are different groups of Epstein-Barr viruses that get triggered at different ages, right, for us. And one of them triggers around 50 years old. It's, I think, group 3, Dr. Phan, if I'm not mistaken. And so if you have that kind of virus and it sort of triggers around the same age as menopause symptoms, quote unquote, happen, is it the virus causing the symptoms or is it really your hormones? Like Dr. Phan was saying, Anthony has also shared that back in the day, women used to go into menopause and feel great. They used to feel better. They used to feel, more healthy. They would feel freer because once menopause starts, your immune system can become stronger again, which is kind of cool.
Yeah. Do men go into womenopause now? Is that how they works? I don't know.
Yeah, I don't know. It's interesting. So I have another question here. Somebody says, does the cafe au lait spots is that like a liver spot? My daughter has a large scale of it. Could it cause, well, that's a big word, neurofibromatosis, according to conventional medicine? How can we prevent neurofibromatosis?
Well, neurofibromatosis is considered like a genetic issue. There's different ones, like different classifications of it. And in reality, if you're looking at the medical medium viewpoint, it's going to be considered, liver and viral. And, basically there's also toxins that contribute to it, right? So these cafe au lait spots that you see are like liver spots in that they are the inability of the liver to clear it in a natural way, so it comes up to the skin. And obviously, yeah, you're going to go see Dr. Pimple Popper and you tell them about this. They're like, you're crazy. There's no way. It's genetic. And all they do really is, I mean, they'll cut out these big old, the multiple spots on people, and it can get deforming actually, and it's really bad. But I guarantee you, I watch this Pimple Popper show, and you see all these weird skin issues. Liver is involved almost 100% of the time, and plus a viral component. So you see some of these pox that keep on regrowing. What keeps on regrowing? Well, the virus keeps on reproducing, and they're still feeding it gluten and eggs and soy and corn. So yeah, how do you prevent it? It may be already embedded, but you can reduce it. I don't know that you're going to do 100%, but you would follow the protocols as far as cleansing the liver out, reducing the basically unholy four, right? The viruses, the toxins, the radiation, and the DVT and stuff like this. So that would be the mainstay. I mean, you can come a long way, and I think uh, you never know how bad it will get until you get there, right? So let's say you had neurofibromatosis for 30 years, and then you have all over your face, and it's impeding your airway. Well, maybe if you did this way, you would never have it that bad. It might still be there, but not as bad.
Yeah. Yeah, that's so it's a big question, what was the root cause of neurofibromatosis? I think probably as you took your daughter to a doctor and the doctors happened to mention this name, in the medical realm, this condition is genetic. It's classified as genetic, and it's classified as tumors growing and surrounding the bone, et cetera, et cetera. We know from the information that medical medium shares that a lot of pretty much every growth that happens in the body, other than happening because of just pure radiation, happens because of Epstein-Barr. So if neurofibromatosis were to occur, it would have a viral component at the very least, if not also toxic heavy metals and sluggish liver and, evidenced by this change of the skin color. So,
And you can get this in utero. You can pass this to your children, right? Your metals will be passed to your children. Your viruses can be passed to your children. So they say it was genetic, and it's like, well, it can happen during formation of the baby, right?
yeah, exactly.
Another tip here is that if you guys ever have a question about some medical topic, one of the things you can do is you go into your internet search and you type in whatever diagnosis or disease process, medical medium, and see what pops up. You'll see things that are related, and you can kind of make an inference of, hey, this is similar to this, and draw conclusions from there. So sometimes that's very helpful.
Yeah. I agree. That's a good way to research. All right, our next question is from our Natalie, and she says, what is the cause of hemiplegic migraines and how to resolve them?
Again, from the medical medium standpoint, we have the unholy four that contribute in different degrees depending on each person, right? How bad is your pathogen? How many toxins have you been exposed to? How much and what kind? What kind of metals what alloys do you have? So the thing is, if you look in, let's say, Cleanse and Heal, the protocols for migraines and stuff, that you can follow these protocols and adopt which ones you can. At the base of that is celery juice, obviously, to help flush things out and help your, the sodium microcluster salts kind of come in there and help pull toxins away. I don't know if you're on the medical medium protocols, but you would follow the antiviral protocols with the cleansing, like the morning cleanse, for instance, would be a good place to start.
Yeah, agreed. That's a very good point. Also, I think hemiplegic are a bit more rare, right, Dr. Phan? Those
Yeah,
types
that's
of
probably, yeah. Hemicrania or hemiplegic. I mean, you can, then that's one-sided, but yeah.
Yeah. So, do they cause? I mean, I know they have a lot of throbbing sensations and they're quite intense, but they can also show up with numbness. I mean, do they resemble a stroke in any way?
You can. I mean, they can. You can basically have some type of like, I don't know, manifestation motor wise as far as one. A stroke is typically you'll have uh, cut off blood flow to an area, right? There's basically ischemia or lack of oxygen flow to the brain.
Yeah.
And where the temporary is a TIA or temporary ischemic attack or a full out cerebrovascular accident or a stroke. So there's
Right.
no enough blood. If there's enough blood flow for longer, it's going to kill off more cells. Whereas a temporary, you'll regain the function within 24 hours. And but they can present very similarly. And sometimes when initially you go present to the emergency room or wherever, they're like, we got to rule out this, and so they do all these like a workup to make sure there's no clot or bleed in the brain, no anything like this. So they have to work you up and make sure that you don't have evidence of a stroke, and then the treatment is different for each one. But you can initially present very similarly.
Right. Um, Also, I think you have a lot more aura symptoms, like things, visual
Right.
disturbances in the visual field and things like
You can
that.
have smells, you can have visual sensations, you can all sorts of different types of neurological manifestations, and it kind of clues you into this is more kind of migraine-ish than nausea or something like this. But you like obviously if you can't you raise hands only this one goes up, and obviously one side is messed up, and or you smile and it's kind of lopsided. You've lost
Yeah,
motor strength.
yeah, yeah. It's hard. All right. I hope that helps with the question. You said how to cure them. I think you have to look at the symptoms and then always look at the viral piece. Always look at hemiplegic. It just seems like the viral attack is so much harder and stronger.
Got to thin the blood.
Yeah, you got to thin the blood. You have to support the neurological system, improve the immune system, really just take all of the migraine protocols that already exist and do them more, but also cleanse and heal get rid of the toxic heavy metals. All of that stuff matters. So I hope that helps. Our next question is about how advise on healing tooth decay. I think one of the biggest things for tooth decay is to start swishing with celery juice, which really makes a difference to support your teeth and get more strength in your teeth, in the enamel. And recently I've been exploring, Dr. Phan, I don't know if I told you this, but um, there's so there's a couple of products that people have been talking about in the community, and I keep getting asked questions about them. So I started to research because my clients were asking me, and I found an ingredient called hydroxyapatite, which is been shown used by NASA to strengthen bones in space and give more bone density and teeth support when people have been in space for extended periods of time. And so there's two companies that I've found. One is Living Libations, but they make a nano hydroxyapatite, which we're always concerned about nano particles and things like that. So I'm curious, but because of that warning about nanoparticles, I don't typically go there. The other product is by Bliss Energetics, and it's a Bliss tooth putty. And again, one big no ingredient in there is pearl powder, which you don't want to swallow. It's got neurological effects, but it's used more like a spot treatment, and they use a hydroxyapatite, but it's not a nano, right? So again, benefit, but also like you have to be careful with it. So my clients who've been using these products, and they're using them smartly and applying them not to swallow the putty with the pearl powder in it, using it as a spot treatment for 20 minutes and washing it all out. I think it's possible to use them in a smart way without getting exposed too much, but they have reported back great results with these products. And like I said, I'm always careful not to push something on the community that is not something that I wouldn't want anyone to be accidentally poisoned or, death by a thousand cuts. So just be careful, do your research, look at what you feel comfortable with. But those are products that are super helpful. A neem enamelizer toothpaste also is helpful for strengthening the enamel of the teeth. There's just so many other tools that can work with teeth. I think building bone back is essentially what teeth support looks like. Dr. Phan, what do you recommend to your clients for building bone back?
So basically, you also have to be worried about in terms of teeth, right? I mean, are you having ammonia that's coming up through your gut and basically dissolving your teeth? So you work on the gut as well. Anthony's talked about silica as a really good for bone and joint and hair and nail support. He's talked about nettle leaf. He's talked about oat straw. And horsetail has silica in it too. So these are some options. MSM, you would consider MSM as well. We don't really think, according to Anthony, he doesn't think glucosamine is very helpful. Maybe for dogs, but not for people. So these are some other things you can use. If you have a chance, Heather, look on Muneeza's website. She has a story of healing with her daughter's tooth, where basically she had a cavity that healed using celery juice as one of the biggest factors in swishing multiple times a day. I don't know how many times, 9 or 8 something times a day.
Yeah, 8 or 9 times a day, swishing with like an ounce of celery juice and getting that going, and it really makes a difference.
Yeah, so you'll see pictures of the cavity being filled in on her website. So it's pretty neat.
Yeah, it's pretty cool. All right, our next question is from Nili, and she says, regarding breast implants, many ladies are having so many viral issues after removal. How can the body be supported? I had breast cancer. First of all, Nili, I'm really sorry to hear that. That's hard to deal with. So viral issues after removal. Dr. Phan?
Here's something, this is like a little bit off, but a lot of women report after taking their implants out, they feel great. They'll, I feel great. And I think there's a psychological release, but also there's an adrenal thing where you basically slice it open and pull it out, and there's adrenaline going. So people have this kind of adrenaline going on after you take it out. But yeah, what do you do? How many, you want to take the pharmaceutical exposure shots, maybe to take some of this chemicals out of you, you have anesthesia and stuff like this, and then you work on the adrenals, right? Because the adrenaline being up, maybe in pain afterwards, or concision, will feed viruses. You can up your viral herbs, cat's claw being one of the classic ones we use, lemon balm to keep you calm you down, L-lysine. These are antiviral, right? All the herbs have an antiviral effect. Some are stronger than others, but you want to use the ones that are the kind of mainstays, like cat's claw and L-lysine. Yeah, bring in micro C, things like this to help the adrenals out.
Yeah, for sure. I think all of what Dr. Phan said, all of what he said. And also, I think what can happen, Nili, is that when you have a big surgery like that, it's a big surgery getting your breast implants removed, or even mastectomies for breast cancer. It's a big surgery. So I think what happens is it can be a strain on the body, and it can trigger anything else that's underlying. That's why those viral issues happen. But you can take all the shock therapies, can be quite helpful post-surgery, like B12 shock therapy, lemon balm shock therapy. So I highly recommend doing those. And also doing things like pathogen exposure shots and turmeric garlic shots. Those can be helpful to help boost the immune system post-surgery. So zinc shock, C shock also helps to boost the immune system, and that's what you want. But typically, if someone was going in to do that type of a surgery, I would encourage them to boost their immune system before surgery, not just after, right? It just makes it easier to deal with. All right, our next question is from Evelyn, and Evelyn asks, heart rate is all over the place. Beta blockers haven't done a thing, just a whole lot of side effects.
Yeah, so that's kind of where you need to talk to your doctor about that. Typically, they'll sometimes use calcium channel blockers too to slow down the heart rate. There are other things you can do, like coming in for cardioversion, but they get your blood thin. So really talk to your doctor about what they can do. In terms from the natural standpoint, you really want to attack the virus as a component, because viruses can screw up can screw up the heart, and you can also screw up the nerves that innervate the heart. in particular the vagus and the phrenic. But there's also a component that he talks about that's neurologic. So you really want to get on the kind of the core 7 in Muneeza uses, or even Anthony's core 8 or whatever he has. And you can use those to kind of calm things down to reduce the viral load and make sure adrenals are not just running all over the place, because the adrenaline can really trigger the viruses to be active. So again, adrenal snacking. Other things we talked about: adrenal snacking, adrenals every 90 minutes to 2 hours. Um, if your blood pressure is not bad, it's not high, licorice is an option, but you have to be careful with that one. And then whatever else we talked about here in terms of knocking down viruses and supporting adrenals.
Yeah, all of that applies. So, Evelyn, I've been working with a couple of clients recently who have been dealing with exactly this issue, atrial fibrillation. They're on beta blockers, and we've been using a lot of the tools to help them regain their health and reduce the atrial fibrillation. And so they were on higher doses of beta blockers when we started, and after working together for almost a year or a little bit more than a year, they're able to come off the beta blockers. Some of them have reduced their beta blockers, and what I'm trying to say is that the tools really do help and make a big difference. So if you're wanting to explore that, reach out to us, schedule a session, contact scheduling at muneezaahmed.com. Yeah, and, reach out so we can give you more support for this, because it's a real issue, which my clients worked in tandem with their doctors, and the doctors supported them. It was great to see doctors working with the natural tools and then working with their patients and saying, okay, I think we can reduce the beta blocker now, and actually helping their patients come off of meds, right? So, but that's what Dr. Phan does too. So with the right tools, we can help you do that. All right, our next question is from Julie. Hilda. I'm sorry, Hilda. I woke up with both of my knees swollen, lots of fluid buildup around the knees. It's painful to walk. I'll be seeing a rheumatologist next week. What can I do to get rid of the edema?
I recently had a patient like this, and she had just the kind of sudden onset of a swollen knee, and it went to both knees, and they thought it was a bone issue, and she saw an orthopedic doctor, and he tried something, and then another doctor tried some PRP, and it was pretty intense, and they thought it was maybe some infection going on because of the PRP injections. So when you see a sudden cause of this without any physical cause, you didn't fall in it, somebody didn't do a sweep the leg, Cobra Kai, Karate Kid move on you, then it could be a viral flare, right? And just make sure that it's not the heart, right? You're laying down, you can't breathe because the fluid's going in your lungs. You want to be careful of that. Again, that's where it's important to have a doctor, so you can say, hey, am I missing something else? You have to be careful of those heart, because he'll lead you other directions and cover his butt and try other different specialists and stuff. So typically, if there are no other symptoms of heart failure or kidney disease, you have to think about a viral flare, because at the root of many rheumatological diseases, including lupus, rheumatoid arthritis, Sjogren's, scleroderma, all these different things, is the virus that causes it. And you can look it up in the literature. Epstein-Barr virus causes a lot of autoimmune diseases. So I would look into a viral issue that may have been triggered by a recent stressor. You got to move, you got a parent, you got a spouse or something like this, something stressing you out, and it flares up all of a sudden.
Yeah. Again, agree with Dr. Phan here. I would say you have something making you super viral. And it's a massive viral flare that's happened. So, check it out. Go into the rheumatoid arthritis section of the book and start reading what the root causes are. Start figuring that part out. And also, I would say, working with, I would work with lots of curcumin. I actually had this happen to me years ago, and I woke up one morning and I had a swollen left knee. It was pre-medical medium, and after I started medical medium stuff, I only had that happen once to me, and even then I took curcumin, lots of curcumin, And again, check in. Is your immune system, if you're waking up one day with that, did your immune system experience some weakness recently? Did your immune system need some support recently that it's not getting? So these are all questions to ask, and these are all questions that will help guide you to giving yourself the right support. So maybe you need more zinc, maybe you need more vitamin C, maybe you could be helped with a vitamin C IV because that can give you a big boost. Bring in some shaga to support the immune system, right? Now let's look at the knee itself. Like, do you need nettle leaf to help with support? Do you need silica? Do you need aloe? Do you need golden seal for antiviral support? Do you need cat's claw? Do you need olive leaf? All of these tools are so helpful to bring in. Lysine, so helpful. So I know it looks like there's edema around the knee, but actually what's happening is that you have a viral injury happening around the knee. That creates swelling. And that's what you're saying is edema. Typically, edema would happen, it typically starts with feet, hands, eyes, face, neck, lymph nodes get swollen, and you start to swell up in these different places. Having woken up with just a swollen knee is not the typical, edema that you would see because your liver is getting more sluggish. This is a viral attack, so it needs to be treated as such. I hope that that helps, Hilda. All
Consider
right.
using frozen water as well. I mean ice on the 5 minutes to kind of decrease inflammation because it helps decrease inflammation.
Frozen water is always a good idea when it comes to bringing swelling down because it's instant. And I actually remember before I met medical medium, that's the one thing I did do. I used frozen water, and it really made a difference. So I would do that. I would do that. So check that out in the books, and really, hopefully you can get some more insight there. Our next question, and before we go on to the next question, for those of you who are exploring your hormones, fertility, menopause, if you're exploring birth, fertility, and things like that, check out the link on the QR code in the top corner of the screen, and you'll see you can join our Blossom program, which is starting tomorrow. It will be open to join. It's a 3-month program. I know a lot of people are considering joining. We've had a lot of people sign up, but it's also a family program. So if you have a family that you want to support on this journey to getting better, to healing more, check it out. And yeah, ask me questions if you have more questions about it. So our next question, Dr. Phan, is from Nirmala, and she says, is it safe to take bioidentical hormone creams like progesterone, testosterone, and estrogen? Dr. Phan, have you ever seen a really good estrogen bioidentical? I haven't. That's why I'm asking.
I'm not aware of one. We all moan about hormones, and Anthony does recommend progesterone, right? The wild yam one. He's on his website at one point. I think it's still there, and it has been helpful in my patients who've used progesterone to ease some of their kind of menopause symptoms. So that's okay to use, I believe. Testosterone and estrogen, typically you will require a prescription for it, and the reason why is because those are substances that have to be controlled and whatnot. Testosterone is a controlled substance, actually. They can feed pathogens, they can feed viruses and stuff. So you have to be very careful about its use. Creams are more safe than oral, the ones you ingest or inject, because you at least you have the barrier of the skin to kind of buffer some of that absorption and stuff like this. But if you have children, or you would like to give your wife a beard and you're putting testosterone on yourself, and then she hugs you, she's going to grab some of that testosterone. If your little kid, 5-year-old walking around with a beard and is like, what's going on here? Well, you've been hugging the baby, and giving him testosterone. So there is some risk involved with that. Obviously, you're not going to be doing that, slathering your kid with testosterone, but you kind of want to put in certain areas. And there's something called dermal fatigue where you use it so long that it no longer absorbs in the same way. So I would be very careful about using testosterone. I still do use them because many of my patients ask for it, and they're going to go see somebody else. So I I'll do them as a favor, but I don't like doing it because you have to monitor them for, hey, look, I know you don't have a uterus, but you still have, and I said this before, you still have breasts that respond to hormones. And not to mention, ovaries and uterus, and all these different things that will respond to hormones. So if you can get away with it, try to avoid them. Some women just like, look, I'm so dry, I need it because it's painful. Okay, topical is better. You're right. And usually your OB/GYN doctor will recommend that. So there is a kind of a way to use it that's a little safer, but you always have to monitor and stuff like this. And if you have vaginal atrophy, you go look at the adrenals. You got to look at the adrenals and see what's going on there.
Yeah, I mean, I think the safest not bioidentical is progesterone. But again, when you use something like that, you typically put it on your belly. But then I would advise you to go wash your hands, like, go wash it off so that you're not touching other people with that hormone on your skin. Estrogen, I'm really not sure or feel comfortable with any good bioidentical estrogen. I've never found any cream myself that I would recommend or that I would even consider taking. I don't think they're safe. I think estrogens can be developed through foods, really helpful foods. Like sweet potatoes can build good estrogen but remove bad estrogen from your body. And, nettle leaf and red raspberry leaf build good estrogens but remove bad estrogens. The problem with estrogens is that they actually are mimickers, and they mimic a lot of plastics. And so bad estrogens are plastics, and other types of hormones, like even hormones in thyroid meds, right, Dr. Phan, are mimickers of what's in our body, and they're not always, they're often quite toxic to our systems.
We are inundated with xenoestrogens, meaning the kind of outside estrogens that mimic estrogen too. So these chemicals that we are exposed to on a daily basis. Testosterone, you really want to look into ashwagandha for that, even for men, because it can help support your testosterone as well. If you're eating a lot of animal protein, according to our friend, animal protein will kill testosterone, and you'll see that in literature. I know guys will like go crazy nuts about that, but guys, men who are like, let's say on the carnivore diet, you'll see these influencer doctors, and they'll have their poster testosterone level, and it's so low. Like, how can he be so muscular yet he has such low testosterone? Because he's eating so much animal protein that is knocking down testosterone level. And it's interesting how that works. There was an article about it. It was very controversial amongst the influencer world about that, how animal protein was pushing down testosterone levels.
Yeah, it's a really interesting conversation to be having, because all the things that are out there in mainstream media about health, mainstream, but yet alternative mainstream. Is that a thing, Dr. Phan? Can we call it that? But
yeah, well, popular alternative, I think.
Popular alternative, yeah. Trendy things, which a lot of people jump on the bandwagon for. Like, they jump on the bandwagon for hormones. They jump on the bandwagon for apple cider vinegar. They jump on the bandwagon for,
Awesome.
yeah, and coffee and all of the things, right? So I think it's helpful to separate the truth from the noise when it comes to hormonal health, and always know that when your hormones are off, if you know me even for a little bit of time, you would know that I talk about this often. And I say it's not the progesterone that you need to focus on. It's not the testosterone you need to focus on. It's not the estrogen you need to focus on, but the adrenals, right? So that's a really, really critical piece to be aware of. All right, I have another question.
Look at this. Sorry.
No, go ahead.
If you like the structure of cholesterol, right? It's a ring-shaped structure, and you can look at Wikipedia. And that ring-shaped structure is the kind of the basis of hormones, where it goes into pregnenolone and different pathways. Okay, you'll see it goes to testosterone, and testosterone converts to estrogen. But another pathway, it goes to cortisol. Okay, your body has to determine, am I in a stress state? Or am I in a state where I can be relaxed and focus on reproduction and sex? What's more important, sex and reproduction or survival? And I'm going to tell you, your body goes survival. And so it's going to push its pathway toward cortisol, adrenaline, when you're in a very stressed state. And then so It's like if you put hormones, it's like I tell this all to my patients. You know those champagne kind of pyramids where you
Yeah.
pour down one thing and it kind of trickles down. Well, you throw enough hormones this way, it's going to trickle down into your adrenals, and you'll feel better. But at the expense of other things like driving, viral explosion or suppressing the immune system, whatever it is, it does. And there's many things it can do. So you have to decide because this temporary benefit of the hormones may be long term wise hurt your health.
Right. Right. Here's another question. It's an interesting one. How to heal severe eczema that has now turned into MRSA?
I would say that the eczema is separate, and the MRSA has got into the open wound, basically, right? MRSA stands for methicillin-resistant Staph aureus, a type of bacteria. Staph aureus, Staphylococcus, is all over your skin, right? And we're seeing increased rates of this infection because of the overuse of antibiotics, because of people like me who are writing antibiotics for a cold and things like this, okay? And of course, in the livestock world, there's a lot of antibiotics. So these bacteria are getting smart and they're developing ways around this penicillin, amoxicillin type antibiotics and stuff like this. So that it's everywhere now. They used to be, it used to be rare. It's only in the hospitals, and now it's spread everywhere in the community. So you can get community acquired MRSA, MRSA, what do you want to call it, Mr. Saw. The thing is, it gets infected into that to the open wound of eczema. Eczema comes from usually the liver and heavy metals and viral component too. So you really got to work on the liver and the toxins, and then of course if it's really bad, yeah, take the antibiotics to knock out so the infection doesn't spread, go into your bloodstream and stuff like this for sure. But it's not going to keep it at bay because the eczema has to be addressed as well. So I think they're two separate things, and the MRSA has infected the eczema.
I agree. It's not that the EBV that caused the eczema has now turned into MRSA. You have an eczema that has weakened the immune system of the skin right there, and the ability for an infection like MRSA, also known as Staphylococcus or a type of Staphylococcus infection, is opportunistic and can attack particularly when the immune system is weaker. That's why you don't see most people walking around with MRSA infections. It only happens really when the immune system becomes very weak. So here's a good question actually about testosterone, which I thought I'd pull up for you, Dr. Phan. This is from Cindy, and she says that my husband has a high testosterone level on a recent blood test, which, what causes this? He's 63, not on any medication, and recently started medical medium protocols about a couple of months ago.
So the question would be like, what was his previous testosterone level? I have no clue. Maybe he had a high one and he just has a high one, right? Great, awesome. Many guys who boast about that. If his levels were normal and then later on they got higher, let's see, he was normal. I started medical medium and then it went higher. I would say medical medium stuff helped your testosterone level, right? But again, I don't know the details. It's nice. It's easy for me to cherry pick and say, I would say it's just, testosterone's higher because you're doing medical medium stuff. It very well may be. Is it concerning? Well, if it's prolonged and stuff, you have to wonder if there's something else going on, right? I mean, I don't know the details, but as long as he's not having exorbitant amount of testosterone, which is then converted to estrogen, that's great. Hey, more power to him at 63 years old and not needing certain other, hormone medications or even Viagra to help him feel more energetic and stuff like this. He could be very well that, and he's a hyper responder or whatever it is. I don't really know, but that's good. I think it's a positive rather than a negative.
Yeah. Yeah. So our next question is from Julie. She says, I've been on a steroid inhaler for 15 years, been able to cut back my dose gradually. I'm having trouble cutting it back further. At the 24-hour mark, breath has challenged. How to break dependency?
That's all you, Muneeza. You have the most experience in terms of that, but definitely you would say that you want to support yourself with basically anti-strep protocol, and also maybe some reishi to help with weaning off the steroid a little bit. Support the adrenals like heck, because you've been on steroids for a long time.
But also, I agree with everything you're saying. And if you're struggling to breathe after the 24-hour mark, it means that your lungs are full of a little mucus or fluid, or they're kind of full, and you're going to struggle to um, breathe because of that. And that's very uncomfortable. So I would increase NAC significantly. I would also do as high vitamin C as you can manage, because high vitamin C really knocks back the infections in the lungs and clears the fluid from the lungs and boosts the immune system to the degree that it was high vitamin C that made me able to breathe and come off of my inhalers. So I hope that that helps, and I hope you'll try it. If you need support, like I said, reach out and we'll be able to support you in a session or what have you. But yeah, that should
And
help.
think about the vagus nerve or training nerve being challenged, because sometimes that can cause a shortness of breath. That
Yeah, absolutely. It's those nerves that are causing the issue. Another question that's interesting and related in a way is from Ash, and she said, I've had a lot of out of control strep for about a year. What would be beneficial to take pharmaceuticals? Would it be beneficial to take pharmaceuticals to help keep it in control? Are we talking antibiotics here, Ash? I don't have the money to buy all the subs, and the basics don't make a dent. So, you know what does make a dent with strep um, is a mold exposure shot. The ingredients are cheap. Um, I mean, they're not super cheap. They're not like buy a banana cheap, but they're not super expensive like supplements. And doing a mold exposure shot over periods of time, taking high doses of oregano, vitamin C. Maybe you can't afford all of the supplements, but maybe you can afford 3 or 4.
Thyme tea is pretty inexpensive. Garlic is inexpensive.
And time T
Um,
shock therapy. Time T shock therapy is a game changer for strep.
yeah.
Again,
I mean,
not
but
expensive.
we don't know where strep is she's talking about. We're talking about throat, we're talking about lungs, we're talking
Yeah.
about vaginal. I mean, I don't know exactly where you're talking about, but
Yeah.
regardless, some of these tools can help. But here's the thing with antibiotics, if we're talking about antibiotics, is that it can knock it down for a little bit. And I would use antibiotics if it's a severe, like an abscess or a sepsis, which you in the hospital. But if it's severe, yes, there's a time and place for antibiotics. But if it's out of control, like you're, I don't know, maybe you're peeing on yourself or something like this, or it's really painful urinary infection, that might help give you relief so your adrenals don't run overboard. But what you do is that you create resistance. If I've heard Anthony's Instagram or TikTok live where he was talking about resistance and how it happens with antibiotics, but you kill off a few of the ones that are weak, but the ones that are strong stay over, and now they're going to be more strong the next time around. So each little intervention of antibiotics will strengthen the strep, unfortunately, which you don't want to hear. I'm sorry, but you can you can use them in severe circumstances, but in the long run, use the cheaper stuff we just mentioned to kind of control that a little bit. Also, are you eating grains? Or sometimes these things can trigger, even the safe grains can trigger things, right? So think about that. What is your stress level like? Are you feeding the strep adrenaline, or is adrenaline pushing your immune system down so you can't fight the strep out as much? These are some subtleties that you may want to think about.
And also, another question related to antibiotics is from Tammy Chapa, and she says antibiotics is sometimes needed. According to Anthony, is there ever a situation where you think a prescription antiviral is needed?
So I'm going to say yes. If you have herpes ophthalmicus, basically zoster in the eyeball, and you're going to lose your eyesight, throw the freaking kitchen sink at it, right? So that you can decrease inflammation. But same way with antibiotics, is antivirals will lead to resistance because these viruses get smart. They are wicked little creatures. And I've had that experience in my practice in the hospital when I used to give IV antivirals. You'll see a waning response, really, and you're making things basically meaner.
Yeah. I mean, I think that some people have taken it for shingles, antivirals, right?
Yeah.
Like a valciclovir or a
Mm-hmm.
ciclovir.
Yeah.
Do you see any
Pain,
other
any other what?
any other cases where you would specifically prescribe? I mean, there aren't that many antivirals, right? Medical antivirals.
There's not that many. Yeah, they're not. Like if you have severe, like, shingles rash somewhere, and genital or whatever it is, and it's just crazy, you can't manage it. Yeah, throw it on, right? But just know that you need to work baseline and antiviral shingles protocol to knock it down. And even if you're doing that already, why is it still coming back? Like you got a bad sciatica. I mean, there's other things going on. What's your adrenals like? Where you're stressed out, things like this, right? Your relationships and things like that. These matter, and people don't get paid no attention to them because they're like, well, this is chronically stressed about my relationships or my finances. Those things, unfortunately, do feed the adrenals, which again push the virus to go forward and suppress your immune system.
Yeah, 100% agree. So another question, again, if you're just joining us, we're talking about hormones a lot here in today's call: testosterone, estrogen, progesterone, thyroid, adrenals. Check out the Blossom program QR code in the top left corner of the screen, and you can tap on it and check it out. We're going to be diving more into fertility in these topics, and Dr. Phan and I, we don't like to give away too much, but we're planning a little program for you guys coming in the fall, which is going to be all about hormones. So you might want to jump on this one right now, because this one leads into the second one when we're doing that in the fall. It's going to be
Muneeza will talk about fertility. I'm going to talk about fartility. Yeah, it's
yes,
celery
exactly.
juice. Okay.
Exactly. Celery juice and all the other things that cause fertility, right?
Yeah. Yes.
Well, we cannot ever. You definitely also will get jokes like this on the program. So that's
dad joke.
Yeah, dad jokes, or doctor jokes, as we like to call them here. All right, so I hope you'll join us. Go check out the program. The link is in the top corner. Check the QR code out, and try and figure out if you want to be a part of it. It's going to be super fun, super deep, supporting women to come into more vulnerability and healing of their grief around their reproductive cycles and all of the things that they've ever been through with it. Okay. We have Katie asking, my 19-year-old daughter has been on oral progesterone from her functional medicine doctor. Wish she would read about Any words of wisdom you can share with her?
Yeah, here's the thing. I don't know why the doctor recommended it, right? And a lot of times they'll do it for like sleep or for balance hormones and stuff like this. And some women have, a lot of estrogen, and so they'll try to balance that. Maybe it'll help. I don't know. Oral progesterone has to go through the liver, and it's another hormone to, be processed by the liver. Like another thing the liver has to deal with. A lot of times the prescribed oral progesterone has peanut oil in it. So if you're allergic to peanuts, not a good idea. I get this a lot in the context of my loved one is doing this. Can you, as a doctor, talk to them and change their mind totally? And it's kind of hard unless they're open, right? So you have to be strong and continue to be supportive and not overbearing. Like, I tell you, do medical media. They're going to rebel, especially your daughter. They're like, no, mom's quacky thing. She was into coffee enemas last year, and now she's into medical medium. So just know one of her fads. You want to come in a place of, I'm here, I'll be there. This is not a good idea. Just very, very gently do that. You don't want to push them too much. And she might benefit. I don't know. She's having a good result from this. Go with it. Say, look, great, that's great. Why don't we think about a cleaner version or getting off of that or whatever it is? But if she's having problems, obviously you can tell. She's having breakouts and rash and stuff that's from this. Then you can use that kind of as a way to introduce medical medium stuff. But I'm assuming that the functional doctor and many functional doctors, they're in the popular alternative movement, right? There's all these pop fad type stuff, right? And so it's not always guided by, I would say, medical medium truth principles and stuff like this. So I don't know what question is there a question in that? There's not really a question. I don't know.
Yeah, there isn't a question. I thought maybe you could, share something that could be supportive. Like, I think that, things like, like foods like sweet potatoes are so helpful for progesterone. Yeah. Really helpful.
Yeah. Bring in sweet potatoes. think about
Yeah.
like maybe a holiday. Maybe we'll switch, and if she's too anxious about it, switch to the wild yam cream. Just kind of like, hey, we'll give her a little holiday while you're not gonna have to go anywhere and and see how she does on that. Maybe that'll be a good substitute because for just it's prescription. You're dependent on the doctor to get it. And if you use wild yam, it's no prescription. It's considered, I guess, a supplement or a food, and so you can get it yourself.
Yeah, agreed. I think that if you look up foods that can be supportive, bring that in, and hopefully while she's on oral progesterone, maybe doing a pharmaceutical exposure shot might be also supportive so that she's not, you know, dealing with the effects of that pharmaceutical uh, so badly. Yeah. Um, okay, we have some awesome question. He has convinced her that the cream will give her more anxiety.
I'm not sure exactly what mechanism by that, but again, I think it's a belief that can be challenged. Remember, any fool like me, having a degree or even not, could say this is 100% right. And if I say conviction and confidence, you're going to believe me. And I've got 5 patients who I did my uh, cocaine-ivore diet, and they feel great. They got cured of their whatever, their life. Um, they're living. But and you would say, oh, this doctor says this, so I can do it. It's going to be great, there's so many out there. And 5 years later, like, oh, carnivore diet, I had to bring in honey and fruit, and so I had to adjust it a little bit. I don't know of any carnivores that are churning butter and needing dairy or coffee. I don't know any carnivores that are eating fruit and honey. You know what I'm saying? So it's always they change their mind a little bit. Longevity doctors changing their mind about this or that. They wrote a bestseller, and then the keto diet is no longer recommended by the guy who wrote the keto book.
Okay, yeah, I agree. I agree. Um, all right, our next question is from Lo Livingston, and she says, can you heal a tooth that has pulp exposure? Dentist says I need a root canal, the nerve is dying, and tooth will fail down the road. What can you recommend?
Yeah, I'm not a dentist. I really don't know how to address that very well. Obviously, it's a very serious thing that I'd have to you'd have to talk to your dentist about. Now, they're probably not medical medium uh, versed, so you'd have to rely on other folks to kind of give you a better idea of that.
Yeah, I think from all of the Lorraine, we've done a lot of like interviews with people in doctors, dentists in the medical community in the membership, and they basically shared that when the pulp starts to show, it's time to get a medical treatment done on it because you're not going to be able to heal it from that point naturally. The thing is, you can heal a cavity when the enamel is still quite strong on the outside and you start to develop a little cavity. At that point, you can still really work on it and heal it. When it crosses the dentin and then it goes beyond that, then there's like rapid decay that happens. Very hard to stop it when it's at that point. But before that, you can. At this point, I think that you should be perhaps thinking about, you know, uh, doing the whatever your dentist is actually telling you to do. Okay, so Dr. Phan is, has a busy schedule, so we're already over time. And I think, Dr. Phan, do you have room for one more question?
Yeah, if you want to go, we can knock out a few more just real quick, and we can do kind of spit
Let's do
short
them. Let's do
fire
some rapid fire and see if we can get through some real quick
rapid
ones.
fire. Yeah.
Right. All right. So our next question is, Darcy Lee, been following for 8 years, having tingles and numbness in the elbow down when sleeping off and on about 5 years. Why isn't this healing? Rapid fire. What do you got?
So rapid fire would be your adrenals. I would look into your adrenals and see what's going on. There is still a viral thing continuing being fed and stuff like this, and it's very common. It's very frustrating, very common. I've been doing this for X amount of years, but you have to look and see what's still screwing my adrenals up, my stress levels, my finances, my whatever it is. And if that's the case, are you actually exposed to something in your environment like mold or whatever that's really suppressing your immune system? So look into that. Darcy, I think I've seen you in a lot of the social media things. So basically, you're doing the work, but there's something else that's a chink in the armor, so to speak.
Yeah, adrenals can also weaken the immune system, so also look at that. But those are the two areas that I would consider, Darcy, really boost the immune system and adrenals. All right, next question, rapid fire. Leslie V says, I have a cyst on the palm of my hand. I think it's a volar ganglion cyst. Last time my boyfriend noticed a lump under his armpit. Looks like a cyst too. What causes it? How can we get rid of it? Real quick. You want to go? Or
You good. Good.
EBV causes the cysts most of the time. And how can you get rid of it? Drink pomegranate juice, 32 ounces every day for about a month or more, and it should reduce.
I'm going to do that too.
All right.
32 ounces. Oh, yeah.
Right. Okay. And
melatonin.
right. And our next question is, I just want to, oh, this is a good one. Carrie Marie says, top things to do for my teen with Ehlers-Danlos loss.
Muneeza, go ahead. You have so much experience with this, healing somebody from Ehlers-Danlos loss.
I've helped a family, actually, two mother-daughter heal, actually, and others as well. I've got like at least 3 or 4 other clients who've healed from Ehlers-Danlos loss. And yeah, it's a lot of work to put in antiviral protocols, getting rid of all the crap foods from the diet, removing the toxic heavy metals. Once you dive into that, people heal. And I've got real life stories to share with you. If you want to know more, Carrie Marie, message me, find me on Instagram, or message me at the office at scheduling@muneezaahmed.com, and we can talk with you about how to get help, because it really is available and you can heal. There was a girl who worked with me from the age of about 6 till the age of about 11, and in those 5 years she has come around from not being able to get out of bed to going to a gymnastics class and doing great.
Oh, shoot.
Yeah,
that's amazing. Because
awesome.
the treatment for Ehlers-Danlos conventional is really physical therapy, pain management. That's it. It's genetic. You're screwed. And I was like, what?
Yeah,
but it's amazing some of the posts that she had. I think that you share with us.
Yeah. Well, thank you, Dr. Phan, for your time today. Guys, don't forget to check out the Blossom program. It starts tomorrow. And even if you aren't able to join tomorrow, it's still going to be open for a little while longer, because people are wanting, we have so many people saying, can you delay it? Can we join later? And so the answer is yes, but the bonuses all go away tomorrow. So if you want to join ASAP. 3 fantastic bonuses. Guess what, Dr. Phan? My husband is one of the guests. So yeah, you got it. Yeah, he's one of the guests. He's going to be talking about family and support and the male point of view. And I think it's valuable for a lot of people who want that.
It actually, it's nice to hear from everybody wants to know, what does your husband look like? And but they also want to hear his kind of viewpoint, and it helps kind of like, oh, people really connect with that.
Yeah, that's the thing, and I think who connects with it is the partners of all of the women that I support, right? And they want to know, what does my husband say? And then when they talk, because he came on last time as well, and he just, what he shared resonated with so many of the men, and it just helps strengthen the whole family, I think, to, do more and go deeper. And so this is what you do as well. So I really appreciate you being here.
All right, guys.
All right, everybody, take care. Have a great night, and I'll talk to you soon. We will come on and do another one next month. Join us then. All right, everybody, take care. Bye now.